Welcome to Startup Health Now, the weekly show celebrating the healthcare transformers and changemakers reimagining healthcare. My name is Stephen Krein, and on today's episode, we're going to sit down with healthcare transformer and the CEO of Hindsait, Pinaki Dasgupta. This is going to be a great episode.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Pinaki, it's great to see you.
Absolutely, Steve.
Welcome to Startup Health Now.
Thank you.
It's really been a true pleasure working with you over the past couple of years, and I'm excited to have you on today's episode, not just because of the interesting company that you're building, but also your background and your experience and your entrepreneurship, or your view of entrepreneurship, and in particular, kind of how you're seeing the landscape change and what you think is kind of coming ahead. So thanks for coming in. Let's jump right in. Tell me a little bit about Pinaki, and more importantly, tell us a little bit about what led you to start Hindsait.
Awesome. Sure. Great to be here, and thanks for having me. About me, I color my hair. No, that's kidding. So actually, I grew up in India, and mechanical engineer by training, then did my MBA. Actually, I was a design engineer in one of the automotive engineering firm, one of the largest in India. But in those early days, and I'm talking about late 80s, early 90s, I saw the potential of information technology industry. In those days, IT industry in India is sort of, just about to morph into what it is today. Now it's one of the, biggest. But in those days, the discussion was, and the conventional wisdom was, IT industry is not going to be helpful for countries like India, because India need, productivity. They need to employ more people. But I believe the opposite. I believe the power of information technology industry, and I jumped right in, self-taught myself in coding, and from being a software engineer, grew to become a regional manager, then eventually country manager, and later a global P&L lead. Moved to US, and essentially took India to world map. Sold India, built companies which had P&L over $800 million, and built some great businesses, worked with some of the finest Fortune 100 companies. But then, I saw the healthcare industry today, and it was back in 2012. I had some, great episode in my personal life when I saw up close how inefficient healthcare is. And so that got me started thinking about healthcare, and I started doing my research, and I realized, I call it perfect storm, where you have, all the pieces are in alignment. So you have the business is morphing, the entire healthcare business model is morphing, this $2-3 trillion spend is unsustainable, and then this high-tech industry essentially drove the providers and the payers towards the path towards digitization. And as I have seen in other industry, once that happens, that along with this business change, it creates that perfect storm where innovation drives the next level of business evolution. So I thought, similar to what I have experienced back in the days when IT industry in India was sort of evolving, and I stepped in and had a great run. I see similar opportunity in healthcare, great opportunity to innovate, great opportunity to create new business which did not exist before. And that's what I have done in my life, and that's how I stepped in.
Excellent. So what was the opportunity that you saw in particular, and what even led you to think about something like Hindsait?
So as you see in the name of Hindsait, we have artificial intelligence. So back in 2012, when we are visioning about what this company would do, what the macro thesis that we'll be chasing, artificial intelligence was not in vogue. It was not in fashion as it is today. But we believed in artificial intelligence, and we believe the power of artificial intelligence going to change healthcare, particularly in an industry like healthcare, where a lot of decisions are made by human moment where the human errors, biases seep in, and that could have catastrophic outcomes. It's important that artificial intelligence or technologies such as artificial intelligence, essentially eliminate all those human errors, biases, and makes those decisions consistent, auditable, and that's the power of artificial intelligence. We believed in it, and that's how we started Hindsait.
So had you had experience in artificial intelligence previously?
Absolutely,
okay.
Absolutely.
But you saw a unique opportunity to bring it to healthcare.
Yes.
In what way? And maybe that's a good, segue into kind of what is Hindsait, because I think at the end of the day, the idea of artificial intelligence is exciting, but a lot of people are wondering what impact and specifically what it can do in healthcare. And I think that Hindsait's got a unique model both in terms of the business but also the application.
Great question. And so when we were actually studying the macro thesis, one of the key pieces that drew our attention is the fact that in healthcare, 1/3 of total spend is supposed to be wastage. In fact, Robert Wood Johnson did a study back in 2012. It says 1/3. It was in 2012. $760 billion was wastage. And in that, if you look at unnecessary health services, tops the list. That was then a $220 billion problem. Today it must be a $300 billion problem. So the first thing that we attempted was to eliminate unnecessary health services. And by harnessing the power of artificial intelligence and predictive analytics. So what we do today, we process roughly 1,200 prior authorizations a day.
Prior authorizations?
Yeah, that's how payers today, the health insurance companies, eliminate unnecessary services. Providers are required to submit requests for prior authorizations before a particular diagnostics or procedures could be administered on patient. And then payers in turn end up hiring doctors and nurses in their team to review those requests and make the determinations of approval and denials based on clinical necessity criteria, which is well documented. There are multiple guidelines available. Now, what happens in this process is a lot of errors, biases seep in. So essentially our job as artificial intelligence algorithm essentially eliminate those errors and biases. And what we see is as we bring those prior authorizations into our platform, we immediately get 20 to 40% improvement in prevention of unnecessary services.
And so your target customer then is the insurance company, and they're using this as a way to replace kind of not just a human, but actually a layer of their process. And so give me a real world example of how this is playing out.
Yeah, so no, AI is not to replace human. AI is to make human more efficient. So this is all about making humans efficient, more productive, do their job more consistently, auditable way. So what it does today, so for example, you need a brain MRI, and your doctor provider, your PCP thinks you need the brain MRI, and then your peers essentially will make sure that your providers obtain prior authorization before that brain MRI could be administered. And what the provider would do, you'll send your complete chart with all the details of vitals and history of your illness to the peers, and peers in turn appoint their nurses and doctors to review those requests, and based on your request meeting those clinical necessity criteria, they either approve or issue denials. But in the process, what happens is, that those nurses, nurses or doctors, they may be reviewing, 100 cases a day. So a lot of manual errors and biases seep in. When we are deploying AI, it's consistent. It comes up with a score. So in essence, it reads the entire chart through NLP, and through machine learning, it actually learned all those clinical necessity criteria. And by predictive analytics, it actually scores between 0 and 1. If it's close to 0, it's deniable. If it's close to 1, it's approvable. So based on that, our algorithm sends our deniable cases directly to our board-certified physicians for the final decision making, because only board-certified physicians can issue denial. And if it's approvable, it gets routed directly to a nurse for eyeballing it and issue approval. At this stage, AI is not making the final adjudications for, let's say, an approval, but we believe the AI, as it matures, it will become super intelligent, and it will, in essence, can issue approval, but denial still, because of statutory reasons or legal reasons, it would be sent to a human to make the final determinations.
So are they, is it saving money? Is it saving time? What's the kind of the end result of why people are choosing to work with Hindsait?
So, like I said, it's 20 to 40% improvement in prevention of unnecessary services, which results in several millions of dollars savings per year.
Okay, so better
That's
quality review.
Yes, better quality review, and it's consistent, auditable decision making. That's number one. Number two is, the decision making now, time to process this request is practically real time. The software processes it real time, but then it goes to a human. But as a result of this, the total processing time has come down almost like 40% below. What that means is patients are getting those approval decision faster. Providers are being more satisfied because now they are also receiving those decisions much faster than before. So payers-provider relationship improving. Payers are actually making the adjudication consistent. And by the way, for patient, if an unnecessary services are rendered, it actually could be harmful. So we are saving the patients from harmful radiations or harmful procedures that actually could be detrimental for the patient. So it's good for patients, provider, payers.
Gotcha. So now, going back to when you started the company, and you remember, I'm sure, the original vision for it and what you thought it was going to do, how is it different than you originally envisioned, actually getting out into the market and really bringing this whole product to a real customer?
There are a lot of sweat, tears, and a lot of behind the door word that went in. But our macro thesis hasn't changed. We didn't pivot in a way. That was our main thesis, and we stayed with it. What really happened is these are very complex technologies, NLP, machine learning, predictive analytics, and to fine-tune these with variety of, this is a free text processing. Doctors write these free text notes in multiple different ways for computer to understand all those semantics differences. It takes time to teach the algorithm, and that's where we took a lot of time, but we kept us on the ground. We kept our head low, and we said we have to perfect this, fine-tune this to a place where client just can't say no, and it has gone through multiple layers of scrutiny, and we have shown not once, not twice, but multiple times that it hits all the milestone, all the matrices that we show upfront to our client in terms of productivity improvement, in terms of cost savings, in terms of 20 to 40% more denials, prevention of unnecessary services. It hits all those key matrices.
So turning a little bit of attention to digging a little further into entrepreneurship and kind of your entrepreneurial experience, what have been your biggest challenges in even getting to here? And then my next question as a follow-up is kind of what's the next leap forward for you guys, and what does Hindsait look like 24 months, 36 months from now?
We believe we are going to be a $100 million company by 2020. I firmly believe in it. AI has huge potential. We are not just doing prior authorizations. We are already piloting 3-4 different pilots to improve quality HIDIS measures with one of the largest Blue Cross Blue Shields in the country. We are doing one of the largest integrated healthcare network here across the river. We are actually doing outcomes-based analytics, improving traumatic brain injury patients, what optimizes their clinical care pathway. That's going to be a phenomenal project once it's completed. So AI has multiple use cases, multiple applications.
You're just getting started.
We are just getting started. We believe we are going to be a $100 million company in 2020. And just between you and I, just between us, we are actually negotiating some very large contract with some of the biggest names that we all know about, and it's just going to be announced hopefully in the next couple of months.
Excellent. So tell me about your biggest challenges.
The challenges, like any other startup, when particularly you are coming up with a new idea, artificial intelligence, when we started, there are a lot of questions about what AI is, what it can do, does it offer all the promises that it shows? But I think we are behind all those. We have proven it hands down. Our software is live now more than a year. So it works, and it's been proven. And the challenges that we faced was, like most other startups, raising capital, getting early customer adoptions.
So let's break that down. What's been your biggest challenge in raising capital and kind of attracting the right investors?
Again, it's behind us. We have raised some good capital and from strategic investor that I'm very proud of. And also I put my own money on the table, and because I believed in myself, I believed in innovation, so essentially it was our money that we put and brought it to a stage where investors found it interesting to invest. And today, going forward now, there are a lot of interest from VCs, from strategic investors who are actually following us, and I believe you will see some great announcement coming up shortly.
So before you were able to raise that capital, what challenge did you have to overcome? What was it? Was it education? Was it finding the right investor? What was the aspect of it that kind of was most difficult for you, not just the company, but I'm interested in digging into you.
Yeah, so one, the investor relationship is something that I haven't done in my life before. I was really good in working with clients. I'm really good in making pitches to a client, selling solutions. I'm great in working with people, team building, etc. But I think when it came to investors, so I stumbled a little bit. I think some of my pitches in the early days was not understood, and of course AI is a new technology itself, so there are a lot of doubts, a lot of naysayers, people who even people who were interested, people who actually understood what we do, even end of the day they backed out. They came pretty close, then they backed out because they wanted us to show some more progress. But I think we are behind those now, and from now on I think we are in a place where investors will be very happy to have a seat on the table.
Right. Well, I think every stage has kind of unique challenges. Every time you're raising capital for your seed round or A round or B round, there's just a different set of expectations at each stage. So it's really extraordinary to see how you've executed and continued building on this initial vision of what you had for how AI is going to impact healthcare. When you look at AI in the landscape, kind of how do you see this affecting other aspects of healthcare? Because I think there's a lot of articles and discussions about artificial intelligence and the pros and the cons of it, but how do you see it literally as a sector disruptor?
So data is evidence. The way I see, and I tell that all the time, all day long, that evidence is in the data. And all the decision making that is going to happen tomorrow, unless they're based on real life evidence, is going to be wrong decisions. So, the boards, the CEOs, the C-suite, the CMOs are going to make their daily decisions, their long-term decisions based on evidence. And AI is a way to provide those, consistent clinical as well as administrative decision making. That's what we provide. We believe AI has potential to address every segment of healthcare, right from bedside to marketing, customer support, even a customer call center.
Right.
AI has broad spectrum of solutions, and I believe it's going to touch upon each one of those spectrum as we move forward.
What's the biggest misconception about AI and healthcare?
I mean, it's just not healthcare. I think the misconception is AI, is it a robot? No, it's not. It could be. Is it going to be super intelligent that is going to take over humanity? I believe AI, if we are using AI in the right directions, where it's not AI is not to take over humanity. AI is, in essence, to help us, human, make best decision based on evidence. That's how I see AI. And as long as we are doing that, AI would be humans' best friends. Most doctors that I work with, I talk to, they embrace AI technology. They firmly believe that AI is going to make their life easier, simpler, and more consistent decision making. I think that's what it is.
Excellent. Reading any interesting books right now related to either entrepreneurship, business, or otherwise?
The Mindset is a great book that I read, and I'm a great fan of Mindset, and I believe some of the pieces in Mindset. Yeah.
Tell me about which part of both, either the book or the concept of what we call the healthcare transformer mindset, kind of is either most interesting to you or the area that you're most excited about.
I'm a great fan of your battery included, excluded vision. So yes, I mean, I think this is a great way to figure out whom you want to associate yourself with, where you want to invest your time and energy. And ever since I took up entrepreneurship, I have eliminated those battery excluded and embraced people like you who are battery included, who bring some positivity in my life, and that is very helpful.
So, I think the mindset is kind of part of this. You've been a healthcare transformer in startup health for a couple of years now. Mm-hmm. What's been the biggest impact it's had on you as an entrepreneurship, and kind of what parts of it are most valuable from your perspective for building the company?
Yeah, no, I think the most value that I receive from this association of startup health, besides you, Unity, and others, the friendship that is my ability to connect with fellow entrepreneur. Now I can call 10 or 20 CEOs any time of the day or night, and if I have a question, I could just call and say, hey, my friend or fellow HT, this is something that I'm thinking about. How have you solved that problem? Or what can I learn from you? And I get instant feedback, which I think is tremendous.
Fantastic. Pinaki, it's always a pleasure to sit down and talk to you. It's been incredibly rewarding to watch you execute over the past couple of years. We're excited for what's coming next. And I think in terms of AI, it's nice to see the recognition you're getting in terms of industry looking at and considering what you're doing as groundbreaking. And I think you're just scratching the surface. So fantastic. Keep up the great work.
Thank you. It's a pleasure.
Thanks for being here. Great seeing you, Pinaki. Take care.
Thank you.